About 3 years ago, I had a little tiny growth on the back of my neck, and so they took a biopsy of it, and it turned out to be Merkel cell carcinoma. And immediately then we started into treatments. Surgery, first of all, followed by radiation treatment. It showed up again in the spine. They took care of the one in the spine with radiation treatment and started me on doses of chemo. Even with that chemo, the cancer continued to grow. There are very few survivors of Merkel cell carcinoma.
For Intermountain Healthcare, I was very impressed with their interest in investing in patients and with their interest in not only being a provider but also being a leader.
The doctor mentioned that there was a new sort of thing that had just come out, which was an antibody treatment. He said, I don't see any reason why it wouldn't work.
Immunotherapy is different from chemotherapy and radiation therapy because it uses your body's immune system to fight the cancer. So patients, when they come to the infusion room for immunotherapy, an IV is started. Just like IV fluids, it's given, and then the patient is released to go back home. Patients have little to no side effects, and of the patients who respond, their cancer responds well.
6 to 7 weeks after I'd taken that first treatment, I noticed that the nodules on the back of my neck seemed to be getting smaller. So the next time we went in for a scan, they had reduced by 50 to 60%.
His body responded very well. He had little side effects. The immunotherapy continued, and then with another set of scans, it showed no evidence of cancer.
Had I had this cancer earlier, there's no question I would have passed on already.
One size does not fit all, but in the future, and Intermountain Healthcare is going to be part of that future, we're going to be able to tailor those drugs to patients who would benefit the most.
We're able to do lots of things that we weren't able to do. Began some of my hobbies again, some carving, and we take a walk about 4.5 miles every day.